12 million Australians are this morning in lockdown with the effects of Sydney's growing COVID outbreak spreading south, forcing Victoria to shut down for the fifth time. Victoria's statewide stage 4 restrictions came into force at midnight, plunging businesses back into a 5-day shutdown. It has been sparked by the fast spread of Sydney's Delta variant, including among football fans at the MCG, and overnight the Australia-France rugby test on Tuesday was also named as an exposure site.
There is good news this morning for affected workers, with Premier Daniel Andrews reaching a deal with the Prime Minister for emergency payments. Further north, Sydney-siders are completing their third week of restrictions, but Gladys Berejiklian is resisting calls to tighten rules further as cases spread. Let's begin our coverage this hour with Steph Ferrier in Melbourne. Good morning, Steph. Yet another lockdown for Victoria, so take us through what the restrictions are.
Good morning, Lisa, although it's not such a great morning for many Victorians, because 5 weeks ago this morning we were emerging from our last lockdown, and yet here we are again, plunged back into Victoria's lockdown 5.0 until 11:59pm on Tuesday night as Victorian health authorities scramble to contain these two very fast-moving lines of transmission seeded from New South Wales. Now, the Premier, Daniel Andrews, says that the lockdown restrictions are effectively the same as last time, so there are just 5 reasons to leave your home. They include going out and getting food and essential supplies, also exercising only with one other person up to 2 hours within 5 kilometres from your home, caregiving, work if you can't work from home, and also to get vaccinated as well. Now, masks will be mandatory both indoors and outdoors, as well as click and collect only for retail. In a very veiled swipe at New South Wales, he pointedly said that there would be no browsing here. Takeaway only as well for hospitality, and hundreds of thousands of school children going back to home learning again. This follows another 4 cases on top of the 10 officially recorded yesterday. There are 3 from the randomly infected from the MCG, that Carlton and Geelong game, and 1 who was a close contact of one of the residents at the Ariel apartments at Maribyrnong that was visited by those infected New South Wales removalists. Now, Premier Daniel Andrews says that it's certainly not somewhere that any Victorian would want to be, but this is such a huge challenge that we must do this.
You only get one chance to go hard and go fast. If you wait, if you hesitate, if you doubt, then you will always be looking back wishing you had done more earlier. I am not prepared to avoid a 5-day lockdown now only to find ourselves in a 5-week or a 5-month lockdown.
And Steph, you're there at Amy Park where the rugby match was held on Tuesday night. Why are people worried about that?
Yes, so there were more than 20,000 people that attended this rugby game, and unfortunately there was one person who was infected that was among them. So there are certain areas of level 1 here at Amy Park that are being listed as a tier 2 exposure site, meaning that people need to isolate until they receive a negative result. And the health department says that they will be contacting particularly people that are much closer to this infected person with further information and advice. But the health department is saying for all Victorians to keep an eye out on the exposure sites on their website. They've blown out now to 125 exposure events, and we also know that the Premier Daniel Andrews is saying that he can't give any guarantees that we will come out of this on Tuesday, although he does say that parts of regional Victoria might be able to come out of lockdown earlier if it is safe to do so. It's fair to say that the next 48 hours here will be critical.
Thank you, Steph. We'll have all the latest from Sydney very shortly. Over to you, Michael.
Thank you, Lisa. And of course, these lockdowns are a major drag on the economy and employment, which has been recovering very well up to this point. The Federal Employment Minister, Stuart Robert, joins us now from the Gold Coast. Minister, good morning.
Michael, how are you?
Very well, thank you. Now, the unemployment rate, as we know, fell to 4.9% last month, which was fantastic, and on any other morning would have been headline news. I want to ask you, it's been a great performance so far, but how worried is the federal government about these lockdowns stalling this recovery in the labour market?
I think we're all concerned about the lockdowns, not just the mental health of our citizens in our 2 great cities, but also the impact on lives and livelihoods, Michael. And whilst it's the best of times here in the Gold Coast, I appreciate it's a pretty hard time in Sydney and Melbourne. If we look at the unemployment rate at 4.9%, which is great, but of course that included the first 2 weeks of lockdown of Victoria, and you saw underemployment increase by 82,000 in that city. So lockdowns do have an impact. Pleasingly though, unemployment in Victoria at 4.4%. It's a pretty impressive result down in Victoria.
What's the fear though? We already have business owners in Sydney, for instance, saying they have no choice to put off workers. Are you worried the unemployment rate might spike again this month going into the rest of the year?
Yeah, certainly it'll have an impact, Michael. It has to. And again, we saw that in Victoria for the first 2 weeks of lockdown. We saw the underemployment increase. The good thing about the economy and the great thing about Australians is they're shown to be very resilient. And because structurally the economy is sound, as soon as lockdowns finish, the economy bounces back. Yes to an impact, no to it being long term.
Now, speaking of financial support, yes, tell us about this deal reached last night between the Prime Minister and the Victorian Premier about financial support for Victorian businesses and workers.
I think it's a good outcome, Michael. The National Security Committee of Cabinet met yesterday, and that's when we agreed on the fiscal supports for individuals, raising it to $600 for a week for those who have lost work and they've been working over 20 hours, and of course $375 for those 8 to 20 hours. We did all of that before Victoria announced their lockdown. So the discussion and the deal last night, literally at 10:30, finalised, was to say to Victorians, whilst these personal income payments for 7 days or more, it of course will cover Victoria at 5 days. So once they've actually lost those hours of work, they'll be able to go to Services Australia through my.gov.au and will be able to claim for that payment if they've lost those hours of work.
Given the severity of the virus and how fast the Delta variant transfers between people, do you agree that the Victorian government had no choice, Minister, but to go for this snap, hard 5-day lockdown?
Well, that was the medical advice that Premier Andrews has got, and he's followed it. These are difficult decisions for premiers to make, but we're all in there together, and that's what the decision we made last night was to say, sure, we've gone for 7 days for the payment, but Victoria, we're here to back you in at 5 days. So we're going to back Premier Andrews on this one. OK, and what about New South Wales? Criticism in some quarters that Gladys Berejiklian hasn't gone hard enough with her lockdown. What do you think about that? They've done so well, Michael. Their tracking and tracing has gone so well for over 12 months, so you have to back them in on the decisions they've made. They've done everything they possibly can. I think they just got to the point where they had no choice on the lockdown. Again, these are big cities being locked down. This stuff's pretty hard. It is pretty hard, but we do know, and worryingly, even the Premier is very worried about this, the number of people infectious in New South Wales out in the community was about 35 yesterday. She says she's worried about that, and unless that figure gets to zero, there's no end to the lockdown. So I just want to ask you, pivoting from that, what do you think about, so there's this fevered debate about whether we end up having just to live with this virus. Can Australia live with the virus, particularly the Delta variant? If you think about UK as an example, so 86% give or take with one dose and sort of 64% with 2 doses, they're still getting over 30,000 cases a day and 6 deaths. Yet they've opened their full borders in terms of travel. They've joined in terms of the travel bubble with all of Europe. So they've reached a point where they're saying, well, we've reached almost max vaccination and we're going to live with it. So these are natural steps. Now, we're not there yet. We've still got 33% of our nation vaccinated on the first dose, and we're rolling that through. And we're rolling it through very fast, 162,000 vaccinations on Wednesday. But we will get to a point, of course, Michael, where Australians, there'll be a certain amount that have chosen not to get vaccinated, and we'll just have to slowly open the border and hope and pray and encourage as many Australians get vaccinated as possible. Only 12% of Australians have been fully vaccinated. That's 2 doses. And given, Minister, all we know now about how globally competitive it is to get the vaccines, it turns out it always has been and is a race, isn't it? It's a tough fight, that's for sure. Now, we've got a great security of pipeline going forward. We had a few challenges with supply in the early days, which unfortunately slowed us down. Not a lot. Should we have bought some more earlier? That's the big question. Well, the Prime Minister made the point we'd still be in the suppression stage now, so little would change. But there's sort of 40 million Novavax coming, and the same sort of realm in Pfizer and the same realm in Moderna. So our pipeline is very, very strong. The key thing now is for everyone to get vaccinated. It's not mandatory. It's voluntary, but really encourage all Australians to just step up, book online, get vaccinated.
If you can. Minister, thanks for your time this morning.
Great to talk to you, Michael.
Well, South East Queenslanders are facing a further week of COVID restrictions after 3 new locally acquired cases were announced yesterday. One of them is an airport worker in her 40s who did 3 shifts while infectious on Sunday, Monday and Tuesday. Mask and social distancing rules were due to lift today in 11 local government areas, but the state government has extended them until next Friday.
South Australia has tightened some of its COVID restrictions overnight. Masks are mandatory in high-risk settings like aged care homes, and 50% density rules apply once again. It's also been confirmed 2 men who tested positive at a Medi hotel have different strains of the virus and therefore aren't linked.
OK, let's go to the COVID situation in New South Wales now, and reporter Lara Himes joins us from Sydney. Good morning, Lara. Tell us what's the latest.
Good morning, Lisa. Well, there is another aged care facility which is now put on high alert. This was after a cleaner tested positive to COVID-19. We understand that cleaner was working on Tuesday and Wednesday of this particular aged care facility in Rooty Hill in Sydney's west. We understand that there had been 5 close contacts identified linked to that cleaner. They've all been told to isolate. We were also told by the centre that 90% of their 134 residents are vaccinated and 90% of their staff are also vaccinated. The centre has been closed down for deep cleaning. Visitors are not permitted to enter the site. But it's not just aged care, which is again in the firing line. The medical fraternity also been affected. We understand that yesterday New South Wales Ambulance made it known that a paramedic had tested positive to COVID. They understand that particular worker had contracted the virus whilst in the community rather than in a workplace setting. We also believe that there are 2 other paramedics which have tested positive, but the details of how that contracted the virus is still unknown. We spoke earlier in the week about a patient who tested positive to COVID-19 at the Liverpool Hospital. There's now also been another healthcare worker linked to that patient which has tested positive, and that healthcare worker had also worked at the Campbelltown Hospital. We know that both of those hospitals have been closed for non-urgent surgery. We know that 65 cases were recorded yesterday. 28 of those individuals were in the community whilst infectious. Testing rates sitting at 58,000. But of course, the message is to reduce your mobility and to stay at home.
Lara, thank you.